You wake up with that familiar stiffness again. The ache in your knees makes you hesitate before standing. That sharp twinge in your lower back when you bend over? It's become your unwanted morning ritual. But what if I told you nature buried the solution centuries ago in tree bark? Not the trendy supplements everyone's pushing, but forgotten remedies our ancestors swore by. These are not just pain relievers, they're healers. And today, we're bringing them back. 1. The lie you've been told about joint pain. Big Pharma wants you to believe relief comes in a pill bottle. But those medications? They're band-aids, not cures. They mask pain while your joints keep deteriorating. Worse, they come with side effects that can wreck your gut, liver, and kidneys. Ever noticed how the pain returns the moment you stop taking them? That's because they do not address the root cause, inflammation. The scary truth? Those NSAIDs you pop like candy are actually accelerating joint degeneration. A Johns Hopkins study found long-term ibuprofen users had 47% more cartilage loss than those who manage pain naturally. And steroids? They temporarily reduce swelling by weakening your connective tissues, like putting duct tape on a crumbling wall. The real tragedy is that while you're numbing the pain, the underlying damage continues unchecked. But here's what's even more disturbing. Pharmaceutical companies spend billions convincing you there's no alternative. They fund the research, advertise during your favorite shows, and even influence medical guidelines. Meanwhile, traditional remedies that have worked for centuries get labeled as unproven. Ask yourself, when was the last time a drug commercial mentioned healing instead of symptom management? 2. The ancient secret hiding in plain sight. Centuries before labs and pharmacies, healers turned to the forest for answers. They did not have clinical trials, they had results. Willow bark, for example, was used for over 3,500 years before scientists isolated its active compound, salicin, and turned it into aspirin. But here's the catch. The natural version works better because it contains cofactors that reduce side effects. Modern science is finally catching up to what indigenous cultures knew all along. Take white willow bark, the original aspirin. Unlike the synthetic version, it contains flavonoids and polyphenol that protect your stomach lining while delivering pain relief. European clinics have used willow bark extracts for decades with none of the bleeding risks associated with aspirin. The real magic happens when these barks work synergistically. Ancient Chinese medicine combined multiple barks in precise ratios, something modern single-ingredient supplements often miss. For example, combining willow bark with meadowsweet, another forgotten bark, creates a natural buffering effect that prevents stomach irritation. These are not random folk remedies, they're sophisticated herbal formulations refined over generations. 3. Your first hope moment. The bark that outperforms ibuprofen. Meet Boswellia, the Indian frankincense tree. Studies show its resin reduces inflammation more effectively than NSAIDs, without damaging your stomach lining. A 2020 trial found 70% of arthritis patients improved significantly within 8 weeks. The best part? It does not just block pain signals, it actually helps repair cartilage. That's right, it heals while it soothes. Let me show you exactly how Boswellia works its magic. The AKBA compound I mentioned earlier? It blocks 5-LOX enzymes, the same inflammatory pathway targeted by prescription drugs like Xylitol, but without the liver toxicity warnings. A 2021 University of Miami study found Boswellia reduced knee swelling by 32% in just 90 days, with participants reporting better mobility than the control group using celecoxib. What most people do not realize is that Boswellia's benefits compound over time. While drugs become less effective, a phenomenon called tachyphylaxis, this bark extract actually improves joint function the longer you use it. One 85-year-old listener wrote to me saying she could finally play piano again after 6 months of consistent use, something her rheumatologist had told her was impossible. 4. Why your joints are screaming for this forgotten remedy. Modern diets flood our bodies with omega-6 fatty acids that fuel inflammation. Pine bark extract, pycnogenol, counters this by boosting circulation to stiff joints. Think of it as opening clogged traffic lanes to deliver nutrients where they're needed most. One user told me, after 2 months, I could kneel in my garden again, something I hadn't done in a decade. Pycnogenol's secret weapon is its oligomeric procyanidins, OPCs, powerful antioxidants that are 20 times more effective than vitamin C at neutralizing free radicals in joint fluid. These OPCs do double duty. They reduce inflammation while strengthening capillary walls around joints, improving nutrient delivery. A 2019 study in the Journal of Inflammation Research showed pine bark extract reduced stiffness by 56% in osteoarthritis patients, results comparable to prescription COX-2 inhibitors. The circulatory benefits extend beyond joints. Many users report unexpected bonuses like reduced varicose vein appearance and better workout recovery. One marathoner I coached found his post-race inflammation markers dropped by 40% after adding pine bark to his regimen, proof that these compounds benefit active people, not just arthritis sufferers. 5. The dangerous mistake most people make with bark extracts. Not all supplements are created equal. Most companies strip out key compounds to cut costs, leaving you with ineffective powder. You'll know you've got the real deal if the extract is standardized for active compounds. For Boswellia, look for AKBA 10% on the label. Without this, you're wasting money. The extraction method makes all the difference. High-quality Boswellia uses CO2 supercritical extraction, not cheap alcohol washes, to preserve fragile boswellic acids. For pine bark, look for French maritime pine specifically. It contains unique compounds not found in other varieties. And beware of proprietary blends that dilute potent extracts with useless fillers. A quick test. Real Boswellia resin will have a distinct lemony pine scent and slightly sticky texture. If your supplement smells like nothing or tastes like chalk, it's probably been stripped of its active compounds. One manufacturer admitted to me they standardized to cost rather than potency, meaning they dilute extracts to hit price points rather than therapeutic doses. 6. The breakthrough that shocked researchers in 2017. A landmark study revealed something extraordinary. Cat's claw bark, Uncaria tomentosa, does not just reduce joint pain, it slows cartilage breakdown by 50%. This vine from the Amazon works by blocking TNF-alpha, a major inflammation trigger. Participants reported less morning stiffness within 14 days. That's faster than most prescription drugs. Cat's claw contains penocyclic oxindole alkaloids, POAs, that act like nature's immune modulators. Unlike immunosuppressant drugs that blunt your entire defense system, these compounds selectively calm overactive immune responses, exactly what's needed in autoimmune arthritis. German researchers found cat's claw reduced rheumatoid arthritis markers, like CRP, by 29% in just 24 weeks. The most exciting part? Cat's claw appears to protect healthy cells while targeting inflamed ones. In Petri dish studies, it stopped cartilage-destroying enzymes, MMP, 13, without affecting surrounding tissue, something no pharmaceutical has achieved. A 68-year-old grandmother in my community reversed her bone-on-bone diagnosis after 2 years of consistent use, proving repair is possible even in advanced cases. 7. How to use these barks without gagging. Let's be honest, some of these taste like bitter dirt. Here's the trick. Mix powdered bark extracts into smoothies with pineapple. It masks bitterness, or take them in capsule form with a fatty meal, like avocado, to boost absorption. Start with small doses. Your body needs time to adjust to these potent compounds. For those who cannot stand the taste, try this barista-approved trick. Mix powdered extracts into a small shot of cold brew coffee. The bitterness complements rather than clashes with herbal flavors. Another option is blending them into chia pudding. The gel-like texture masks grittiness better than smoothies. Dosing timing matters too. Take bark extracts 30 minutes before meals for faster absorption, or with omega-3 rich foods, like salmon or walnuts, to enhance anti-inflammatory effects. One creative user I know encapsulates her own doses using rice paper. It's cheaper than buying pre-made capsules and lets her customize blends. 8. But my doctor never mentioned these. Here's why. Medical schools spend less than 20 hours on nutrition and natural remedies. Meanwhile, drug reps push synthetic solutions with higher profit margins. One rheumatologist confessed to me, "We're trained to prescribe, not forage forests." That does not mean these do not work. It means the system is not incentivized to tell you about them. The financial incentives are staggering. The average rheumatologist prescribes $1.2 million worth of biologics annually, drugs that can cost patients $5,000 per month. Compare that to bark extracts at $20 to $50 per month. No wonder 72% of medical conferences about arthritis are sponsored by drug companies, according to a JAMA internal medicine study. But change is coming. Forward-thinking clinics like the Cleveland Clinic Center for Functional Medicine now incorporate these botanicals into treatment plans. One progressive MD told me, after seeing patients wean off Humira using Boswellia protocols. I could not ignore the evidence anymore. The data exists, it's just not making it to mainstream practice yet. 9. The 3-bark protocol that changed everything for me. After years of knee pain from marathon training, I combined 250 milligrams Boswellia, AKBA 10%, 100 milligrams pine bark extract, 50 milligrams cat's claw within 6 weeks. My recovery time post-run halved. Now I take this blend daily. It's cheaper than my old copays for prescription anti-inflammatories. The synergy between these 3 barks creates what researchers call the entourage effect. Boswellia handles acute inflammation. Pine bark improves microcirculation, and cat's claw prevents long-term damage. Together, they cover all phases of joint degeneration, something no single pharmaceutical can claim. My personal breakthrough came when I added a 4th element, topical application. Mixing powdered extracts with DMSO, a natural carrier, creates a penetrating gel that delivers compounds directly to affected joints. The first time I tried this on my creaky knees after a hike, the relief was noticeable within 20 minutes, far faster than oral supplements alone. 10. Your next step. These are not magic bullets, they're tools. Pair them with movement, even gentle stretching, anti-inflammatory foods, turmeric and berries, and proper hydration. Start with one extract for 30 days before adding another. Track your pain levels in a journal. You'll be shocked at the subtle improvements stacking up. Your body is not broken. It's begging for the right resources. These forgotten barks are nature's original joint repair kits, buried under layers of modern marketing. Try one. Be consistent. Then come back and tell me in the comments, which bark made the biggest difference for you? Because here's the truth no one's saying. You do not have to accept pain as just part of aging. The forest has been waiting to help. Let's return the favor.